Students at the University of Nevada Reno deal with everyday pressures such as jobs, grades, and exams. It takes a diligent student to do well in school, but it takes a student with courage and determination to endure all the usual stress of college while at the same time battling cancer. For some students at UNR, this is their challenge.
First of all, in a way, when I was going through cancer, I felt like I changed as a person, like I got better. I mean, I went through a lot of, I guess, psychiatric help a little bit because I've been in those phases where I was just really depressed, I guess, in a way.
Depression is just a part of what cancer patients deal with. They also have to deal with other students who are sometimes cruel.
And like a lot of kids, they don't understand, so they'll make fun of you or whatever. But when I relapsed, I was already like in a better attitude, and I was really, I was really confident with myself. So I went to school with no problem, really. It was mostly I felt bad because my friends didn't know what to say to me.
Hematologist-oncologist Dr. Torkeldsen says it's important for young patients to try and maintain a somewhat normal life.
Well, I think for adolescents and young adults, the best thing is to try to keep their life as normal as we can. I try to not restrict people in what they can do except when it's absolutely necessary to protect their health. And so, allowing them to go to school, allowing them to have a job if they can be employed, working their schedule, their chemotherapy schedule around a work schedule or a school schedule so that they don't have to make a choice between those things, I think is really critical.
Living a normal life for Lone was having a social life, but due to her sickness, she couldn't be around crowds of people.
I went through phases where I had to wear a mask. Like I could not get sick. Like my immune system was way too weak. So those are the times where, I just kind of like brushed it off my shoulder. Didn't really care because a lot of kids were, there was this one guy, I was just walking past him and he's like, oh, what do you have, SARS or something?
While wearing a mask can be difficult, losing your hair can be embarrassing.
A lot of cancer patients with a bald head, but that's not how you lose hair. Like usually when you're losing hair, either your hair is thinning out or you just lose bits and pieces of it, and then it won't lose all of it in a way. So it would look weird if you had some hair, and so people shave it off. That way it grows back evenly.
Yes, you don't have hair. You know what? It's going to grow back, okay? And we're going to give you medicine that's going to make you feel icky, but once we're done with giving you that medicine, you're going to feel great, and it's all going to get better.
Lone has an amazing positive attitude, and she even knows how to find the bright side of cancer.
Some patients actually lose their eyebrows, which is really weird. I didn't personally, but a lot of facial hair and just everywhere in your body, your armpits, your legs, you're good. So those times I didn't have to shave my legs, so it was great.
The first sign of a problem for Casey was a severe headache that led to an emergency visit to the hospital.
We went into the hospital and they took my parents into another room and said if we don't do something tonight, he's going to get very sick. My mother proceeded to ask how sick. They said very sick, and she asked how sick again, and they said that if I didn't have emergency brain surgery that night, that I was probably going to slip into a coma or die.
Casey was saved by brain surgery, but his life will never be the same.
It's absolutely the most defining experience of my entire life. I can honestly say that most of the things that I'm doing with my life now in terms of ASUN, school, and any other activities I take part in is primarily due to the fact that I was diagnosed with cancer.
One way Casey's life changed was that it became very difficult to be a student.
I still have a lot of trouble with short-term memory, like a lot of trouble. I could have graduated after the cognitive test. They said that I could have graduated with an actual special ed diploma because the short-term memory loss was so severe for so long.
But Casey found ways to work around his disability.
There's a couple different ways that I can kind of cope with it. And it sounds kind of silly, I think, sometimes when I say it, but I have to do everything 3 times in order to remember it. So if I'm taking notes for a class, especially any math classes, I try to take notes either by hand or on my laptop and then do it the other way a second time. So if I type all my notes in my political science class, then before I actually go to study for it, I'll handwrite all of the same notes over again, and then I'll make note cards. So the process of doing something 3 times makes it a lot easier for me to memorize things. I still have the ability to do it, it's just more work.
As with Lone, Casey and his family somehow found strength not only to deal with cancer, but even to joke about it.
And my family, kind of like our way of dealing with things is humor, so we had always joked for probably the entire time they thought I had a sinus infection. We would joke that, oh, you know, sorry mom, I can't take the trash out, I have a brain tumor.
As we've seen, being a student with cancer is not easy, but the university does provide support and sympathy.
I can only imagine being, you know, receiving that diagnosis and know that for many of them they're in the fight of their life, and a lot of times you need assistance with how to cope with that and how to deal with that. I think that's perfectly natural. And again, we do have some excellent resources here on campus that they can work along with their emotional well-being while they're dealing with their physical well-being, and then we help on the academic end with their academic well-being, and it's a good combination that way. You know.
This is Lindsey Gross, covering the effects of cancer on campus.